All right. So again, my name is Dr. Ben. I'm with ViveWell Health. And today, the topic of our conversation is the proactive management of traumatic brain injuries and concussion. Now, a bit about my background. I was an emergency medicine critical care physician for many years. Ended up getting an MBA in health administration and pursuing a number of advanced certifications and training, including neuroendocrine, neuroinflammatory management, chelation therapy, ozone, hormones, peptides, and then we do a number of genetic and epigenetic managements. So traumatic brain injuries are a very big deal in today's healthcare landscape. Clearly, it's the leading cause of death in people under 45, and the amount of burden on society is actually pretty large, right? 2% of the population. And you can see from this diagram from WebMD that this really crosses all socioeconomic classes. So we have pro athletes and people who ride bikes to little kids who bump their head and old people who slip and fall. But ultimately, brain injuries certainly can kill people, but it's the folks who aren't dead that actually live with the most disease burden. And so what we're going to show here is that this is something that is causes a big problem in people's physiology, but there's also something that we can do about it. Now, as an emergency physician in the hospital, when people come in, our biggest thing is really to look and make sure if you have a bleed in your brain or if there's something we need to intervene about. But once we've made those decisions, even the leading clinics like the Mayo Clinic have shown really that there's no treatment. We're returning people to normal life if they can in a limited fashion. And really, people are focused on rehabilitation, working with a large team. And this is physical therapy, speech therapy, occupational therapy, etc. So even neurology, they're really pursuing this watchful waiting sort of approach. Certainly, there's this time after a head injury where if you repeat the injury, people are known to have worse consequences, but neurology is still doing more of the same, where they're trying to be conservative management and trying to even just tell people to stop doing what they love because it's too hard. So the most convincing data, I think, comes from the VA, where healthy soldiers, these are the healthiest people. You can't have high blood pressure or arthritis or any pre-existing medical condition to be a soldier in the military. But what we know is 1 out of 10 soldiers are going to have a problem recovering from concussion. And even the VA is saying, well, let's go ahead and send them for acupuncture or mindfulness or yoga or chiropractors. And all of these things are good. But when we look at our healthcare expectations, if 90% of TBI people recover, that leaves 10% that aren't getting better. And the question we should ask ourselves is this good enough? If 10% of heart attacks or strokes aren't getting better, or if 10% of anything isn't getting better, 1 out of 10 in the healthiest individuals may not be enough. So what I'm proposing and what we do here at ViveWell Health is that we offer evidence-based medical therapy for traumatic brain injury. And just because there's no defined treatment does not mean that we shouldn't be treating TBI. So today we're going to go over some of the pathology of what happens with the TBI, some of the symptoms associated with concussions, and then some of the evidence-based therapies that we use in our management of head injuries here. So a couple of the key points. Neurotrauma causes inflammation, okay? And we're going to come back to this. And this the inflammation alters the chemistry that's going on in your brain. And that's, of course, the hormones and the signaling neurotransmitters and a number of the bodily functions. And these chemistry and inflammatory problems cause psychiatric and cognitive dysfunction. And then this cognitive dysfunction ultimately culminates with a number of the neurodegenerative illnesses that our society is increasingly being burdened with, like Alzheimer's, Parkinson's, multiple sclerosis, and ALS. But the psychiatric and cognitive dysfunctions are actually things that are very real as we'll look at the symptoms. So this is a busy slide, but the point here is to show that after someone hits their head, there's a very well-known cascade of secondary brain injury, ranging from inflammation to lower energy production at the mitochondria, or we start seeing reactive oxygen species and oxidative stress. And then even right after an injury, we start depositing the proteins that end up causing Alzheimer's, Parkinson's, etc. So this is very well known. And again, another busy slide, but what I want to show you is that a brain injury on top causes a very quantifiable inflammation, and it goes in one of two ways. Either this will resolve, or people get stuck in this chronic inflammation and neurodegenerative illnesses. So what causes people to either get better or not? And it really comes down to this fundamental principle that we're trying to encourage in people, which is resiliency. Okay, so resiliency is your status prior to the injury and whether or not you can resist the injury or the chemical changes of the illness. So this affects the outcomes on how we make our hormones and the energy production and the antioxidant and inflammatory responses that the body has to deal with. Now, things that promote resiliency are many of the lifestyle things that we know we should do, or at least many of us are learning about even more. And this is, modifiable behaviors like nutrition and exercise and sleep and hydration and sunshine and breathing and stress relief and toxin exposure. But it's really hard to change that if people are already sick. And so if someone has inflammation or oxidative stress or any number of pre-existing medical conditions, this is going to affect resiliency. So this is a busy slide, but the idea is on the left here is that any level of gut dysfunction, chronic constipation, diarrhea, leaky gut, or high blood pressure, or if you're a little overweight, or maybe if you're just aging, right? Some people age faster than others because of the hard life they've had, infections, depression, diabetes, the list goes on. Essentially, what this shows is that these underlying conditions really are a manifestation of systemic inflammation. And that inflammation, instead of people having the normal resolution, people end up having this neuroinflammation, and there's a number of cascades here. So the idea, let me go back, the idea of hidden medical conditions lead to unresolved inflammation. And so if we were to go back to the VA data, where 1 in 10 healthiest young people, these are 18 to 25-year-olds, they're the healthiest people after medical screening. So for the rest of the population with any hidden medical conditions causing unresolved inflammation, we know that the chances of not being able to fully resolve from a head injury is actually more than 1 in 10. So what I'd like to then talk about here is this is a figure of the pituitary gland, which is responsible for causing hormones. So the pituitary gland lives right up here in the front of the brain. And so in concussion, this little blood vessel right here on the anterior pituitary can be oftentimes disrupted. And this is going to cause problems with a number of the hormone cascades on the anterior pituitary. And so this is clearly documented here. So this is thyroid, right? Thyroid dysfunction is your metabolism and a number of body factors, including weight control and obesity. Adrenal glands, this is how we manage cortisol in our body, stress resiliency. And then we see here the sex hormones. So this is affecting early onset menopause, problems with fertility, difficulty with spermatogenesis, andropause, and hormone fluctuations in men and women. And then growth hormone. This is muscle mass and stature. There's a number of immune functions as well. So clearly right here, we see that TBI and concussion can affect the pituitary and then this massive cascade of hormones. And this is what we do. We, in part, with much of the post-acute management of concussion is we're helping to balance and try to wake up this pituitary gland so that people's hormones can be affected. So this is from a great study, more than 15 years ago, where clearly we see increased body fat, weakness, fatigue, loss of libido, infertility, heart disease, shortened lifespan, weight loss, weight gain, attention deficit, memory problems, and these are clearly related to a number of hormones. Now, when we're thinking about this, is it going to happen to me or somebody I know? Now, here's a great study from 2006 that showed at 3 months, 56% of people had hormone dysfunction. And even at 12 months, 36% of the people studied still had hormone problems. So we know this is going to happen to many people, and it's worth paying attention to. So what are the symptoms of TBI, right? We see here in the one column that there's physical symptoms. I just gave a presentation in Keystone to a bunch of the ski instructors, and admittedly, they said, we're asking them if they have a headache or neck pain or dizziness or any numbness and tingling. And so, of course, people may have some of these symptoms, but then it's going to lead to sensory issues with light and sound or visual changes, ringing in the ears. But then this leads to the cognitive stuff that we were talking about, where maybe memory, attention, and focus is more of a problem, difficulty finding words. And here's where things that you can't see start to happen. People start being more agitated. They're more moody. They start having anxiety or even self-doubt. Okay. And then this then leads to outward behavioral symptoms that really affect the people around them. So we start to see impulsive behavior, verbal outbursts, physical anger, getting lost, and sleep difficulty. So this actually ends up with a number of diagnosable conditions: anxiety, depression, OCD, symptoms of PTSD. These are all known to be related to neuroinflammation. But these then lead to other societal problems like substance abuse, domestic violence, right? Which then lead to family problems. And then we have the whole fatherhood statistics where kids who grow up in a single family home and are more likely to be overweight or have teen pregnancy or not go as far in school. So there's a huge cascade in someone's personal, family, and community life after traumatic brain injury. There's an interesting study, I don't have this slide here, but there was a study in prison populations, and over 75% of the patients or the people who are incarcerated has a history of diagnosed TBI. So it may have an underlying role in a society at large when people are incarcerated as well. So really, this is our question. Reactive watchful waiting can really risk months and years of suffering, and some people's lives are ruined by it. And really the opportunity when someone has a head injury is to choose proactive care that targets risk to optimize healthy outcomes. And this is what we do here at ViveWell Health. So in our management, we believe that immediate therapy should be started within 24 to 72 hours. So that is the nutrition, where we use the morning shake, and we're offering brain inflammation nutrition. We also utilize intranasal and IV anti-inflammatory signals. So these are exosomes and the use of platelet-rich plasma or platelet therapies. And we've brought on our new precision platelet therapy platform called TrueDose. Now, I'll take a minute here to just pause and just to acknowledge that in professional athletics right now, we see people have a head injury, and you'll notice that they escort the player off of the playing field or the court, and they disappear into the stadium. And I have it on good account that oftentimes they're giving exosomes, which are the messages of stem cells, and we'll talk about that later, but they're giving exosomes within 90 minutes. So it's wonderful to hear that professional athletics are taking care of head injuries now, whereas in the past, as you saw on the first slide, that 99% of professional athletes who are football players have evidence of chronic brain damage from hitting their head so much. So finally, we see athletics is making a change, but we've been doing this therapy for years, and that's really helpful. So step 2, we do lab testing. We have a very robust biomarker and nutrition panel. And then we have a number of expanded therapeutic options like the platelet-rich plasma, exosome stem cells, TrueDose, and then we use a number of other fancy therapies like peptides and methylene blue and a number of other tricks up our sleeve. So let's talk about regenerative therapies. Platelet-rich plasma uses your own growth factors, and this has been used for decades in orthopedics, regenerative orthopedics. But in neurological instances, it's been proven to be neuroprotective, to help nerves grow and to modulate the inflammatory signals. So we have 2 products really. We have an activated PRP with nutrients and light, and so there's peripheral stem cells that are there, and in the right patient, this is a fantastic therapy. We also have this precision data-driven platelet therapy based on condition, which is the TrueDose. Okay, we use umbilical stem cells as well. These are ethically sourced stem cells from umbilical cords, and these have been proven to protect and regenerate tissues and nerves. So they again modulate the immune system, the inflammation, and can change some of the oxidative stress on the tissues. Stem cells have been shown to improve cognition and learning and memory. And then the exosomes, for those who don't know, these are a tiny bubble with a message. This is how stem cells communicate with the tissues around them. Just like with little children, if you're blowing bubbles, imagine if you blew a bubble, but you whispered a message, and that message then went across, and when the bubble pops, the tissue around there gets the message. So these are exosomes. They're going to cross into the brain readily. They decrease inflammation, and they promote a number of healing mechanisms for repair and recovery. Another word about the TrueDose regenerative therapy. This is that advanced precision treatment that we use your own body's immune system to treat. Now, if we think about the immune system, there's the white blood cells, there's the antibodies and immune globulins, and then there's platelets. Okay, platelets are responsible for much of the healing that happens. For example, if you were to skin your elbow, right? So when you get a scratch, platelets make the blood clot, they make a scab, they make scar tissue start to happen, and they wake up stem cells so you can start rebuilding your skin. So in platelet therapy, much like the story of Goldilocks, there can be, not enough, too weak or not concentrated enough. There can be the just right dose, or there can even be too much, where you can stimulate the immune system and actually go past the direction that you wanted to and actually start to cause harm. And so for this example, we test your blood in the office, we calculate exactly the type of dose that you need, prepare this, and then deliver it to you in a therapeutic way, both IV and intranasally for head injuries. So this has come up a couple times, and I think it's worth explaining. Why intranasal therapy? So if we think about it, the nerves in your nose are the only exposed parts of your brain. So when we deliver any regenerative treatment into the nose, it's a minimally invasive, proven therapeutic delivery to the brain. Now, people have been using their nose to administer medicine for a long time. many of us have heard of cocaine, but there's a number of other intranasal treatments, whether it's for headache or anesthesia. But ultimately, the idea is for our purpose to get the regenerative message to travel along the path of the nerves, to bypass the blood-brain barrier, and to deliver a healing message to the brain. So at ViveWell Health, we have advanced care for brains. And so we want people to be proactive to reduce risk so that they can stay healthy and still have a lot of fun. So step one is nutrition and inflammatory support. So get people on our morning shake and our brain inflammation nutrition protocols. These are right on the ViveWell.Health shop, where you can click on those and order them. You can come into any of our 2 clinics, either in Summit County in Dillon, right by the tech center, or in Arvada. We have these in stock, so people can swing by and start that right away. We do lab testing, and then also we offer the advanced therapies that are used in professional athletics, but these are evidence-based therapies that are safe and effective with lots of data behind them. So the idea at ViveWell Health is more energy and less pain so you can feel better, but our brain rejuvenation program is really based on science and here for people, whether it's acute head injuries, people who are stuck and can't get better, or people who are more progressed into the chronic neurodegenerative problems like Alzheimer's, Parkinson's, and a number of other degenerative neuro conditions. So it's been great. We've had some great outcomes with people. On our website, we have many testimonials, but our staff is just tickled every time we see people who comes off a medicine or they've noticed that things are working better. And so it's been really exciting to see people get better. So at this point, what I'll do is I'll skip to see if we have any questions. I'll get out of this here and then get back to our perfect. So let's see attendees Q&A. Perfect. I'm hoping this will be recorded, so I can finish watching this. Cool. So somebody has to jump to another call. Are there any questions at this time from anybody else? What would you recommend for parents whose kids have an injury? This is a great point. So certainly, I believe nutritional therapy is very helpful. And on our brain injury, so the morning shake and the brain nutrition inflammation, we have written instructions. Typically, things are weight-based. Okay, so for a full-grown adult, it's full portions of those. And then I think it was kids under 100 pounds, move to a half dose. And then certainly if you've got a little kid who's, maybe 50 pounds, you could go to a quarter dose. But I think most of us realize that food and exercise are the best medicine. And so these nutrients are safe for all ages. It's just finding the right dose. We also, so if children have head injuries, and we've taken care of the range of hypoxic brain injury to people who were premature and have had incomplete neurological growth. We can also administer stem cells and exosomes to that child. We don't need an IV. There's techniques to do that. So someone asked, could a big hit on the head cause headaches and migraines? Absolutely. Absolutely. There's actually a lot of data to show that migraines can be related to hormonal changes quite often. But certainly there's also a number of musculoskeletal injuries, and even the neural signaling affects the blood flow in the brain. And so that's something we can help with too. Yeah. Any other questions? All right. So I guess I'll leave it here. And I'm really glad that we had a chance to have a conversation about this. And I'm looking forward to doing more webinars about different topics. And thanks for joining.